Today topic of discussion is diabetes mellitus or hyperglycemia. Diabetes mellitus is a symptom characterized by inadequate insulin secretion or lack of insulin and leads to hyperglycemia, both acute and chronic complications. The symptoms include polyuria, that means increased urination, polytipsia, increased thirst, polyphagia, increased hunger, weight loss or weight gain, then glycosuria, increase that glucose level in urine, that is reducing sugar, any glucose, fructose, galactose presented in urine. Name is called glycosuria. Then acidosis, acid in the bloodstream, then leads to coma. These are the symptoms comes under diabetic mellitus. What are the symptoms? Polyuria, polytipsia, polyphagia, weight gain or loss, glycosuria, acidosis and coma. After we eat or drink, our body breaks down food and gives energy our cell. To accomplish this, our pancreas need to produce a hormone called insulin. Insulin is what facilitates the process of pulling sugar from the blood and putting it in the cell for use or energy. Pulling sugar from the blood and putting it in the cell for uses of energy. Diabetic mellitus occur when insulin production is deficient. This results in a high level of blood sugar in the body. Without insulin, our body glucose cannot enter the body cell and is excreted through urine, which result in its loss and an increase in the blood glucose concentration leads to loss of water in the cell via osmosis to blood. To understand what happened in diabetic patient, we need to understand what happened in the normal mechanism. Whenever the blood glucose level increase, the pancreas responsible by secreting insulin. Blood glucose level increases, that time pancreas responds by secreting insulin. Insulin has two functions here. First, it converted glucose to glycogen, increases the metabolism of glucose in cell. This is how the glucose level fall and blood sugar level goes back to normal. The pancreas will secrete less insulin when the blood sugar level is low. It decreases the glucose metabolism and gives the chance for sugar level to increase or return the blood sugar level to normal. People with diabetes are having problem in their pancreas. It produces insufficient insulin. So it stops its effectiveness to process glucose. So the people have problem with the pancreas means it stops to process glucose. Next, moving to types. It have two main types, type 1 and type 2. One more type is the gestational diabetic, that one mainly affected the pregnancy period. Type 1 is also called as insulin dependent diabetic mellitus. This one due to autoimmune destruction of beta cells. So absolute deficiency of insulin. Second one is non-insulin dependent diabetic mellitus. This one lack of insulin production. Third one is during that gestational diabetes during period of pregnancy. Type 1, it is an immune system disorder. Our own immune system attack the insulin producing cells in pancreas, destroying our body's ability to make insulin. With type 1 diabetes, one must take insulin to live. They compulsory need insulin for the living process. Most people are diagnosed as a child or young adult, as it is inherited one. It is a genetic one. So we must diagnose this and will take treatment. Its symptoms include frequent urination. What are the major symptoms? Polytipsia, polyuria, polyphagia, weight loss, weakness, dizziness and blurred vision. Other symptoms: skin infection, irritability, headache, tiredness, dry mouth, fatigue. These are the other symptoms. So type 1 is a genetic one. So compulsory we need treatment. That means we will take insulin. Type 2, pancreas produced enough insulin. Pancreas produce enough insulin, but something goes wrong, either with receptor binding or insulin signaling inside the target cell. The cell are not responsive to insulin and therefore cannot import or bring glucose. Glucose stay in the blood. If uncontrolled glucose production or decreased glucose uptake by cell. Here again genetic factor predispose susceptibility to the disease, but it is believed that lifestyle play a important role for type 2. Typically obesity, inactive lifestyle and unhealthy diet. What are the main reasons for type 2? Obesity, inactive lifestyle and unhealthy diet. How to manage? The management focus weight loss and low carbohydrate diet. This one is insulin resistant obesity is the prime risk. Poor lifestyle, dietary and exercise habit. We will control type 2 diabetic. Then symptoms, major symptoms: weight loss or gain, polyuria, polydipsia, polyphagia. Then genital fungal infection, neuropathy, micro and macro angiopathy. Then other symptoms are blurred vision, decreased vision and impotence. What are the other complications of diabetes? It causes atherosclerosis, then microvascular complication like thickened capillary basement membrane. It leads to nephropathy, kidney failure, retinopathy, blindness, neuropathy. Neuropathy, more than 50% of all diabetic patients have. Then it leads to impotence, neuropathic pain, then neuromuscular dysfunction, then decreased resistance to infection. So these are the major complications for diabetic mellitus.